Well, the biggest reason why I registered for iTeach was because I wanted to learn the most innovative and new ways to teach and precept new nurses. For me, one of the biggest takeaways from iTeach is that you can never stop learning. You can always learn something new, and even though you think you might know, how to do something, there's always a better way to do it. The biggest thing I would tell someone who was going to take iTeach is to just go all in. Be involved, get involved with the instructors, get involved with the faculty, and just be part of every single part of the program.
So my name is Yvette Valadez. I am the Pathway and Magnet Program Director at the VA North Texas Healthcare Center. So a lot of my role involves educating on staff on shared decision-making, shared governance, pathway, and magnet designations. And I recently picked up a clinical adjunct position with the Tarrant County Community College District. So I am educating our first semester nursing students in the clinical setting. So I meet them at a clinical site and watch them put all the knowledge and skills that they learned from their theory and skills lab into their clinical practice. So it's really fun to engage with new nursing students who are just fresh-eyed and ready to, take care of our patients. So the reason I joined iTeach, my mentor knew that I was starting this new clinical adjunct position with Tarrant County Community College, and so she had already enrolled in this program, so she gave me information, and based on what I read online from the UT Health Science Center about this microcredential for iTeach, I decided that it'd be a great fit for me to get the orientation that I would need to take on this new role as a adjunct faculty or nurse educator. So really great background information to get that journey started for me. My biggest takeaway from iTeach is there's so many different ways to teach our students to really apply what they know into practice, but I really learned a lot of the terminology that goes into nursing education because never having worked in that field before, I didn't really understand competency versus checklist or even formative versus a summative assessment. So a lot of those basic foundational knowledge I did not have. So iTeach really gave me a lot of that foundational knowledge that I needed to be the best educator that I can be going on to this new journey as an adjunct instructor. I would encourage others to join the iTeach cohort if they are wanting to explore a new journey as a nurse educator, or B, if they wanted to update their knowledge, skills, and competencies regarding nursing education, because I think that it's important for nurses to always be up to date with the latest and greatest. And I feel that through this program, you learn a lot of different information regarding being a great nurse educator or a preceptor. And there's a lot of information here that I learned that I think that I know. There's a lot of information that I learned that I immediately implemented into my practice as an adjunct clinical instructor. So I think anyone that's considering joining this program would really get information that they could immediately apply into their practice and to be the best educator that they can be.
My name is Sue Ann Cantamessa. I am a professional development specialist at the Dallas VA. I joined the inaugural cohort of iTeach because it came to me as an email, and I had no idea what it was about. And I would like to get back into academia. I've been adjunct faculty in the past, stopped when I was doing graduate work, and really feel that that's my love. That's where I need to be. Putting the passion back in nursing, and iTeach enabled me to see more clearly some of the ways that I need to go now, because students are different now. My biggest takeaway from the iTeach program, I think, was the integration of so many different techniques and so many styles that I had no idea when I was learning how to be an educator, and the interaction between the faculty and the other members of the cohort was really inspiring because everybody came from different places, and what people saw and what people felt about things was very different than maybe I would have thought at the time. So it stimulated a great deal of thought for me. Something I would tell somebody who's considering iTeach: don't delay. It's enriching, it's fulfilling, it's exciting. It's just education has evolved, and it's a way of keeping up with what needs to be done now based on the students that we have, people coming into nursing as second careers, as well as, entry level. For me, it was a way of finding a way to reach the passion that I know people have to be nurses.
Hi, I'm Sandy Monashagan. I'm one of the new faculty members here at the College of Nursing. So I decided to join the iTeach program for a couple of reasons. As a clinical educator, I was recognizing that we are attracting candidates. Sometimes it's hard to attract the right candidates. Sometimes it's hard to retain them. And I felt like a lot of that hinged on education, the education that brought them to us and the education that we would provide to keep them with us. And so I recognized that there were probably some opportunities for me to grow in that knowledge, to help our nurses want to stay here and engaged to take care of these patients. I would say that my biggest takeaway from the iTeach program is just permission to imagine something different, to imagine that you can teach in a very innovative way and it can still be effective. I welcomed the permission to kind of challenge everything that I'd been taught, everything that I had seen, the way that I had been educated, to deliver something better. And so I loved having that conversation. A little more meat to it when I had all of the information that they shared with us. But I really loved being able to imagine education, and nursing education in particular, the way that I felt like I would have loved and to have experienced it myself. If anybody were to ask me about iTeach, I would say no matter what your role is in nursing, there's something for you in that space. Whether that be learning more about emotional intelligence and what that looks like in practice, or imagining academic partnerships and ways that you can partner with other areas in your neighborhood and your community to make practice better for both. There are so many opportunities and so many pieces that fit regardless of your nursing title, your position, or where you work. So absolutely, it's right for anybody.
My name is Martina Gallagher. I'm an associate professor at the School of Nursing, the Siskey School of Nursing at UT Health, Houston. I've been working at UT Health for about 15 years, And I've been a faculty member, or I've been in nursing education for about 25 years. So I decided to join the first cohort of iTeach because I saw it as an opportunity to learn new things and be exposed to what is up and coming in simulation. We do simulation at the School of Nursing, but I wanted to kind of refresh my skills and learn more about, the use of virtual reality, or the use like we learned about Prism, the room. So learning a lot of new things. Also because you have a lot of experts. iTeach brings in a lot of faculty members who are experts in the field. So to kind of be exposed to them and to kind of learn from their knowledge has been a really good, valuable experience. So my biggest takeaway from iTeach was that virtual reality is probably the future of nursing simulation education. The space here at this university is so well used. I think it's an exemplar. So to be able to come to the campus and look for the iTeach and see the campus and see the simulation has been wonderful. So I would say that's my biggest takeaway. I think I'm a faculty member with all the years not that I was against simulation, but it was more, we can still teach it the old way, but I think coming to campus and seeing it has really flipped my thinking. It really changed it to where, if we're saying that you can educate nursing students, 50% can occur, the clinical experience can happen in simulation, well, why not? And use the space. The hospital spaces are limited. All the nursing schools are competing for it, so we need to educate our nursing students in our own homes so then they can actually go to the hospitals. So I would encourage people to participate in iTeach because it will really change their perspective about the different tools you can use to educate nurses in the future or currently. For example, the use of the escape room. They give you tools on how to use the escape room. They give you tools on low tech, no needs for simulation, where you can actually learn how to use, they called it the tag. Also, they spoke a lot about the importance of pre-debriefing the pre and post debriefing being so important. So I think as faculty members, we need to be aware of that. So coming to a place like this or being in an environment like iTeach is great because you can learn all those things. And it's so short, it's 8 weeks. So what you're getting in this course is something that you would probably get in a semester in a education minor, and it's simple. The sign up is simple, so it's worth it, definitely.